Assalamualaikum warahmatullahi wabarakatuh. I, Muhammad Amal Group 2, along with Nur Aisyah ROSMAN, Nur AINI, Nur Aisyah MUNTADAR, Muhammad IZZAT, and also NORKAMALIAH, will be presenting on normal variant and no treatment required.
First and foremost, what is normal variant? A normal variant is an atypical finding that is seen in a percentage of the population which generally has no clinical significance and is considered within the spectrum of normal findings. Based on the article, it stated that some oral conditions, despite their different physical features, are not pathological. Rather, they are considered normal such as linear alba, parotid papilla, geographic tongue, and fissured tongue. So, how frequent these cases arise in dental clinics? Based on the article, 692 people with an average age of 35 years participated in this study. The overall sum of oral cavity normal variations was 806. 542, which 66.5% cases of which were female, and 264, which 33.5% cases which were male. 30 to 59 each group had the highest frequency. The prevalence rate is presented in tables 2 and 3 based on age. Linear alba was the most prevalent variation in both sexes, which torus and geographical tongue among women, and geographical tongue and Fordyce granules were the most common cases. Furthermore, the difference can be due to racial differences and dissimilarities of the study population.
For the next slide, what is no treatment required? As the variants are within the spectrum of normalcy, no treatment is required for the patient. Certain tests can be carried out to avoid a misdiagnosis because some symptoms of the normal variants are very similar to those of a disease.
The first normal variants that we are going to discuss is oral melanotic macule. It is a pigmented lesion caused by deposition of melanin in the tissue of oral mucosa, and it may occur at any age without gender predilections. Oral melanotic macule is characterized by dark brown, occur as solitary or single, have a well circumscribed margin, and usually round to ovoid shape with a diameter less than 1 centimeter. It can be located at any oral site such as buccal mucosa, gingiva, or palate, and it do not darken upon exposure to sun radiations. Oral melanotic macule may be misdiagnosed as other pigmented lesion, especially oral melanocytic nevus, which has almost the same presentation as melanotic macules. So a proper investigation must be done to differentiate all of the pigmented lesions. So the next one is Fordyce granules. Fordyce granules are actually sebaceous glands that occur on the oral mucosa. And as seen in the picture, Fordyce granules, are also known as Fordyce spots, is characterized by small, multiple, yellow or whitish papular lesions with symmetrical distributions. And the lesions are typically asymptomatic, but the patients may be able to feel a slight roughness at the mucosa. It is commonly located on the buccal mucosa as seen in the picture and vermilions of the upper lip. It is closely similar to normal sebaceous glands found in the skin, but it is absence of hair follicles, and it is more common in adults than children due to hormonal factors. And histologically, these sebaceous cells are polygonal in shapes, containing centrally located nuclei and abundant of foamy cytoplasms. Moving on to linear alba. Linear alba is an asymptomatic horizontal white linear lesion seen on the buccal mucosa at the level of the occlusal plane of the teeth. Linea alba is a common finding and most likely associated with pressure, frictional irritation, or sucking trauma from the gum surfaces of the teeth. Linea alba may be caused by cheek biting, orthodontic appliances, friction of the dentures, uneven teeth, or aggressive oral hygiene, such as brushing your teeth vigorously, which may cause injury to the oral mucosa. And women are more commonly affected due to frequent cheek biting habit in women compared to men. Linea alba is often mistaken for leukoplakia, which also shows white lesions on the oral mucosa. Hence, a proper investigation must be done before we come up with a definitive diagnosis. The next one is leukoedema. Leukoedema is a common, asymptomatic oral mucosa condition of unknown causes. It may be associated with smoking, chewing tobacco, alcohol ingestion, bacterial infection, and salivary conditions, but none are specifically proven causes. And leukoedema is characterized by grey to whitish lesions, usually occur bilaterally, diffuse, and has filmy or milky surface alterations. And in exaggerated cases, wrinkling or corrugation may be seen on the buccal mucosa. The opaque white changes of leukoedema dissipate when stretching the buccal mucosa. Histologically, it shows thickening of the epithelium with intracellular edema of the spinous layer.
The next case is called parotid papilla. It is a projection of parotid duct's opening into vestibule of oral cavity. It is located near the upper second molar tooth and appear as pink with papules. Parotid papilla commonly affects more men than women. Torus palatinus forms towards the posterior of the midline of the hard palate. It is rounded and symmetrical in shape and consists of mass of dense lamellar cortical bone, and an inner zone of trabecular bone sometimes can be seen. It should be removed if it interferes with the fitting of a denture or becomes ulcerated. Next is the torus mandibularis. It is similar to torus palatinus, except it is formed on the lingual aspect of the mandible above the mylohyoid line. It appears bilaterally with hard rounded swelling. Torus mandibularis consists of a nodular mass of dense cortical lamellar bone and an inner zone of trabecular bone with associated fatty marrow sometimes can be seen. If the patient requires denture, this torus mandibularis shall be removed. Last case is fissured tongue. It appears on dorsal surface of tongue with variety of depth fissure and margins. It is very common condition affecting 2 to 5% of the population, and any spicy or acidic food intake may cause burning or pain sensation to the patient. This fissure may cause food stagnation, and the proliferation of bacterial and mycotic flora may occur. This fissured tongue along with lip numbness and also facial paralysis are the features of Murchison-Rosenthal syndrome that commonly affect Down syndrome patients. And that's all for common cases of normal variants of the oral mucosa.
So this is the case example of normal variant and no treatment required in dental clinic, which is linea alba buccalis. As what we can see here, there is a white line along the line of occlusion on the buccal mucosa. We call it as linea alba buccalis. Let's move on to the case report. A 22-year-old male patient came to the clinic with complaints of elevated white patches on his buccal mucosa of oral cavity. On examination, it reveals that it was nothing but normal linea alba with no sign and symptoms and ulceration. Linea alba is the common presentation patient's oral cavity where most of the time doctor confused with other pathology, which is not so. It is benign hardening of the mucosa inside of the mouth due to excess keratin deposition. When the oral mucosa is repeatedly aggravated, it develops a layer of keratin, which is what appears as a white line. Our aim is to present this case report is to increase the awareness among doctor and patients. The main reason for this patient report to the OPD is the fear of cancer. So for this case, the patient were given preventive advice.
Next is diagnosis, treatment, and awareness. The patient is diagnosed with linea alba, which previously was misdiagnosed, as the patient was under treatment for months in general medicine and cancer department. There was no treatment done except for advising the patient to remove the irritants or irritants that caused the condition. For example, cessation of habits such as cheek biting, aggressive oral hygiene, and adjustment of orthodontic elements, including uneven teeth, dentures, and other appliances. The patient might seek counseling to help manage habits, and the dentist or oral pathologist probably will schedule a follow-up appointment to determine the condition.
That is all from Group 2. Thank you for listening and have a nice day.